Do you often feel like you are lost or confused when you go to your provider's office? If so, I have 6 tips to help you advocate for yourself. Stay tuned. Hi loves, my name is Tiffia Stokes and I'm here to empower you with the knowledge that you need to know so that when you go to your provider's office, you feel like you are getting the best out of your appointment. So if you're new to the channel, please hit that subscribe button. Tip number 1 is write down your signs and symptoms. So you may have not gone to the provider's office in a few months or a few years, and you may have had some symptoms that have not been addressed. So you want to make sure that you come equipped with those signs and symptoms, maybe treatment that you've used that has worked or did not work. So make sure that you come equipped with those signs and symptoms to better be able to help your doctor or provider get to a diagnosis for you. Tip number 2 is bring a loved one. You want to do that because you're getting bombarded with so much information from the provider that you may not be retaining all of that information. So that extra someone will be able to explain things to you later on if you've forgotten. And also they may ask questions that you may have not even thought to ask the provider. So it's important that you bring a loved one just to have that extra set of ears and a different perspective on things. Tip number 3 is bring a notebook. It may be the notebook that you've already used to write down your signs and symptoms. It can be as small as you want, as big as you want, but bring a notebook. In addition to having those signs and symptoms written down or any questions that you want to address, you want to make sure that what the provider is telling you, you're writing that down as well. Regardless if you have a loved one there or not, you want to make sure that you equip yourself and you write down things for your review later on. That includes maybe diagnosis that the doctor has given you or the provider has given you, medication recommendations, medication frequency, the dosing, signs, symptoms, tests, specialists that you may need to go to. You need to write down everything so that you have that information later on. Tip number 4 is ask questions. Ask questions, ask questions, regardless of what the question is. There's no stupid question. This is your life. This is your health. Even if you feel like you need to interrupt the provider or you're interrupting the provider, that's okay. You need to make sure that what the provider is telling you, you're retaining and you're processing it and you're understanding it to the best of your knowledge. So if you're feeling brushed off, afraid to ask the provider question, it may be time for you to find another provider where you feel comfortable in asking those questions. And you need to have that relationship and that rapport with your provider so that you feel comfortable in your health. So ask questions, ask questions, ask questions. Tip number 5 is please put the cell phone away. You may have questions that you want to ask, but that cell phone in your face is distracting you and causing you not to be able to remember those questions that you want to ask. So put it on silent. The messenger can wait. The messages can wait. The notifications from Facebook and Instagram can wait. You want to make sure that that time that you're allotted in that appointment is used productively. So silence your cell phones. And it also decreases the retention of information you're getting from your provider. So please silence your cell phones when you're in the provider's office. Tip number 6 is do your own research. So I would recommend doing it after you've seen the provider and you've been equipped with the information, because then you can look at the full picture of what the provider has told you versus what you are researching on your own. And use a reputable site such as UpToDate. Don't just Google and use sites with ads or that aren't reputable. Use a reputable site so you're getting the best information. And also, when you or if you need to go and get a second opinion, you have everything right there for that provider that you're seeing for that second opinion. So research your own information. And those are the 6 tips to advocating for yourself when you're in your provider's office. So if you feel that this video was helpful, please like, comment, and share. And if you feel that it wasn't helpful, please comment as well and tell me what I can do better. Thanks for watching, and I'll see you guys next time.